Now we're moving to the third part of you trying to confirm acute rheumatic fever. The third part being it that the patient came to the hospital, you took history as a first component, you did physical examination to make sure that there's all those joint pain, maybe erythema marginatum, all those skin patches and all of that. So on the third part, we are sending some samples to the lab, so results are expected to come back. So from the result, what are the things you are expected to pick up? That's the laboratory features, right, for acute rheumatic fever. Basically is to support diagnosis, okay, and primarily is to confirm that a group A streptococcal infection exists. You are trying to also pinpoint those inflammatory markers. That's some things are coming up in the body and they are helping to confirm that there's an inflammation. In acute rheumatic fever, there's inflammation of the heart. All right, so you are trying to confirm, okay, using some lab tests. So throat culture, that's we took some samples, that's mainly saliva, then you grew it, then you can see Group A Streptococcus. That's what actually caused the sore throat. Okay, then organisms move through blood to cause issues in the heart. The rapid antigen dictation test, that one too can also dictate the Group A Streptococcus. Antistreptolysin O titer is usually elevated to show you that the body is trying to defend itself, okay, against the Group A Streptococcus. Anti-DNase B titer, another marker, will show that there is a Group A Streptococcus infection. Markers of inflammation, this one they confirm that there is a whole lot of inflammation going on in the body. So there's elevated erythrocyte sedimentation rate, there's elevated C-reactive protein, there's leukocytosis, there's increase in white blood cells because the white blood cells are the soldiers of the body. So there's elevated cardiac enzyme because to show that there's an injury to the heart. So troponins are high. Echocardiography is not a lab test, but it should help you to pick all those inflammation in the heart. Okay. Then other supportive test is you still do ECG and you see that there's a prolonged PR wave. Okay. Then synovial fluid analysis show that there's an inflammation in the joint. Okay.